So today we're going to talk about the nasal cannula, one of your low flow devices. What makes it low flow is it does not meet all the patient demand. We'll get into that in your lecture. So it's super important that you know the difference between a low flow and a high flow system. Your nasal cannula can be used on infants as little as term, 40 weeks, up into adults, but today we're going to talk about adults mainly. So as you can see right here, you have the prongs that are going to go in the patient's nose. It's super important that you put it in correctly because it can be quite uncomfortable if not. So as you see, the prongs naturally go at a curvature that would go down the patient's nostrils or nasal passages. So you want to make sure when you put it in their nose, you put it down this way, wrap it around the ears, unless you have a small baby and you'll wrap it behind their head. And then you want to tighten, this doesn't fall off, tighten this up underneath the chin to make it more comfortable. Nasal cannulas are super useful for patients that want to talk while they're receiving oxygen therapy. Also patients that want to be able to eat, sleep, that sort of thing. Patients that are claustrophobic may do better with a nasal cannula. It does feel kind of funny at first, so when you put it on the patient, make sure that you guys are coaching them through it and saying that you're going to feel some flow through your nose. That's totally normal. And then place it in their nose. I will show you this. If you put it in incorrectly in this way, it's very uncomfortable, as you can see. It will fit, but it's not comfortable, and they'll complain that something's poking them. So please make sure that when you put it in their nose, the prongs stay downward and not up. So we're going to place this in the patient's nose, and then the other part of the cannula is going to go to your oxygen source. Now, you have to have a Christmas tree in order for this to work, so make sure that you have a Christmas tree or a nipple adapter on your flow meter. And your range of flow for adults range from 1 liter to 6 liters. So we'll just turn it up to 1 liter so you guys can see it. Your liter flow range is 1 liter to 6 liters. Your FiO2 is 24 to 40% oxygen. And there's also a calculation in your book or in your slides, so make sure you review that to help calculate what your estimated FiO2 would be based on the liter flow that you've provided to the patient. Anything over 4 liters per minute requires humidification, and when we get into the humidifiers, we'll talk about that in further detail, but please know that anything over 4 liters needs to have humidity, because it can dry out their nasal passages and that can turn into nasal bleeding and trauma, things like that. So that's it for your nasal cannula.